All right, today I got a mic. I have a book with me because I was actually in the middle of cleaning my closet, which is a disaster. It's embarrassing, but, anyways. And I came across my iBack study guide, and basically, this is the book that we receive when we start electrolysis school, laser hair removal, things like that. So it helps you. It has a ton of information, helps you study for the state board exam. Anyway, so I was flipping through it and I came across a part that talks about PCOS. And for those that don't know what PCOS is, it's polycystic ovary syndrome. And so it's a very short article, and I kind of just wanted to do like an overview of it so you see the information. And if there's anything that I may share that causes you to question whether or not you have it because of some things in here that you say, you know what, I may have some of the symptoms, I strongly recommend that you check in with your primary doctor. Um, if you've done testing before, like blood work and stuff, and if come out as you're normal, I highly recommend you finding a functional doctor who will would just do a little bit more in-depth blood work, will test different things, so that you can get more information, because I feel like a lot of my clients who definitely have symptoms of PCOS are being told that everything is normal, but deep down inside they know, and I know, that it's not normal. So again, I'm not a doctor. This is just my opinion. I, but that's what I would recommend that you do. So, anyways, what is PCOS? So again, polycystic ovary syndrome is it affects women. It can affect women's menstrual cycle, ability to have children, hormones, heart, blood vessels, and of course, appearance. It can affect between 1 to 10 and 1 in 20 women in the childbearing age. So it's estimated, at least the time of this book, right? I'm sure it's a lot more at this point, that over 5 million women are affected with PCOS. And it can start as young as 11 years old. So, a lot of women, a lot of my clients are between the age of like early 20s to maybe like late 30s. It also says that the underlying problem with PCOS is hormonal imbalance. It causes women to make more androgen than normal. Androgen are male hormones that we also create. So again, it's causing an imbalance where you're creating more of those male hormones. Researchers also think that insulin can be linked to PCOS. So a lot of clients with insulin resistance, they may show signs of it in weight gain, maybe like early diabetes, um, a dark patchy area on the neck. All of that is caused by hormones. Excess insulin appears to increase production of androgen, which can lead to acne, excessive hair growth, weight gain, and then problems with ovulation. Some of the symptoms with PCOS, here it states infertility, infrequent absence and or irregular menstrual periods, hirsutism, so increased hair growth in the face, chest, stomach, and then back, thumbs, and toes. So again, a male pattern. Cysts on the ovaries, acne, oily skin, or dandruff, weight gain, um, male pattern baldness or thinning, patches of skin on the neck, arms, breasts, or thighs that are thick, dark, and brown. So again, that goes back to insulin. Skin tags, pelvic pain, anxiety, depression, and sleep apnea. Those are all things that can give you a clue that maybe you are dealing with PCOS. Now, there's a ton of other things that also have those same symptoms. So this is why it's important that you consult with your doctor if you feel like that is something that you may be struggling with. The diagnosis says that there's no single test to diagnose PCOS. Most of the time, they'll probably do some medical exam, physical exam, pelvic exam, blood test, vaginal ultrasound. And then as far as treatment goes, you can do hormonal therapy, lifestyle modification, healthy eating, exercising, all of those also will help. And um, maybe some doctors will prescribe birth control. Diabetes medication can help. Fertility medication in case you were trying to get pregnant, but PCOS is getting in the way, then you might have to look into those. And then last resort would be surgery, but I feel like that would be like really intense. And then, of course, I think the most annoying, not the most annoying, but the most frustrating part of PCOS too comes with facial hair, especially being a woman. We are not intended to have those really thick beard like hairs, and it can really affect how we feel about ourselves, our appearance, our confidence, and everything, and how, you know, how you treat it matters. So some of the treatments, of course, as many of you know, is electrolysis, which is what I do. That is permanent hair removal. The book does say laser hair removal. Again, do not do laser hair removal on your face if you suffer with PCOS. I highly would recommend against it. In some cases, we could maybe start off, but it really depends. It's on a case by case thing. There are some medicines that are called anti-androgens that may be paired with a birth control, and those are things like spironolactone, which is going to help with hair growth and clear acne. It helps reduce the impact of the male hormone. It was originally a high blood pressure medicine, but it has shown to kind of help regulate. And then you have finasteride, which is a medicine that's taken by men to prevent hair loss. And again, like I said, anti-androgens may be used with birth control as well. So again, all of this is just information to help educate you and hopefully give you a little bit more information on what PCOS is. And if you feel like you are experiencing some of these symptoms, then I highly recommend you go see your primary care, find yourself a functional doctor. And if you are ready, you've been diagnosed and you're ready to start electrolysis, we can help you. We're located in Miramar, Florida, so you can just contact us. But I hope this video serves you, and good luck.